We're now going to have a fireside chat with Joe Cody, who is founder and CEO of Grain Fertility, as well as the Associate Director of Health IT and Digital Health Policy at the American College of Cardiology. And I'm really excited to be talking with Joe about the topics of fertility and it's it's sort of the continuum into the menopause space. Joe is an IVF dad who has worked on healthcare policy and advocacy since 2008. He's the founder of Grain Fertility and an active volunteer leader with Resolve, the National Infertility Association. He also serves as the Associate Director of Health IT and Digital Health for the American College of Cardiology. He lives outside Washington, D.C. with his amazingly supportive wife, their 4.5-year-old daughter, and their rescue dog. So, Joe, thank you so much for joining. It's a pleasure to talk with you here today. And I know we've got some really compelling topics based on our topic of menopause today. But let's talk a little bit about fertility and menopause and that transition. They're often viewed as separate phases of a woman's life, but there's actually a lot of overlap. So from your perspective, how do you see the relationship between fertility and menopause evolving, especially for women who are transitioning through perimenopause, but may also still be trying to conceive?
Yeah, thanks a lot for having me. I appreciate that question, and congratulations to all of the people who are in the challenge. I think there's some fantastic innovations coming in this space, and I think it really fits into a lot of the things, that are happening in both the fertility and menopause space. These are both areas that have been chronically underfunded, they're understudied, so we don't really have a lot of good data to show, outcomes and these other things over time. And I think this is an issue that is incredibly important to the fertility community, especially considering multiple diagnoses that people will have that could be contributors to infertility. My wife is a good example of this with a diagnosis of diminished ovarian reserve. She was perimenopausal in her early 30s, and that eventually led to our diagnosis and our IVF journey. So there's a lot of overlap between these patients. And, I think it's really exciting to be able to see how, all of this can kind of come together and how care and management can evolve in this. As we look at the patient population, people are waiting longer to have children. There's been 132% increase in women in the age 40 to 44, having children since 1990. And so these are women that are going to be in this perimenopausal space, yet they're still having these goals of being able to grow and achieve a family. So this gray area really starts to emerge. And then I think you also have this kind of generational change that's taking place as well. And as Dr. Beckley noted earlier, you see this increase in the desire for ownership, having data. People really do want to track all of this stuff, and they want to understand what their health means, how they can make more informed decisions, be involved in that communication with their process. And so I think these challenge companies really showed that, collecting this data, being able to have a better understanding is incredibly important about that. And then all this leads to a better understanding of how there could be a tie-in between the two. As I mentioned, kind of some of the diagnoses that happen in this space, but there's also increasingly the need to be able to manage both at the same time. Individuals who are perimenopausal are going to have multiple symptoms that, are going to be either exacerbated or contribute to some of the complications and symptoms that people have as they go through fertility treatment. So what this really actually leads to is the need and desire to have more specific care that's directed towards that individual, and also having longitudinal care that goes beyond these separate sites of service, where you have a reproductive endocrinologist only managing some components of a woman's health, while her OBGYN or endocrinologist or other specialists are managing other. We really do need to have this ecosystem that treats a more holistic approach to women's health if we want to try to deliver better outcomes that are better for each individual.
Yeah, and you mentioned data, and you mentioned this more sort of customized, personalized intervention or solution. Can you talk about those things together? Like, how is the data that we're able to collect as it relates to menopause and fertility challenges, and tying that into personalized medicine? How can we leverage that data to support the more personalized understanding, innovations, and solutions as we are thinking about these life transitions between, childbearing years to, the fertility challenges and perimenopause and menopause. Do you have any thoughts on like the tools that are collecting the data, how we can better use them, and how the information that's being captured can be better used to serve the individual needs of the women and the families who need it?
Yeah, I think there's been a lot of advancements that help in this area as technology has evolved. One is new techniques and technologies that allow for more precise individual measuring of hormone levels that can be tracked both individual points of time or longitudinally. So you can really start to identify trends in a women's health, to be able to say, okay, what this could be a contributor, what are ways to manage those symptoms, or what's the appropriate course of treatment that's prescribed to that individual as opposed to kind of a population level approach to this. And, it's often said, we can't change what we don't measure. So over time, as we try to measure this stuff, and have more access to information, I think that will only help. But I think we're also starting to see, the ability to tie this into other areas that's perimenopause and menopause impacts in women's health. And, there's growing evidence about the increased risk of other diseases. So heart disease, diabetes, stroke, osteoporosis, all these other things that have to be managed as a person goes through the menopause process. Those are all things that need to be examined, managed, and appropriately treated by the medical care team. So that kind of goes back towards this more care team based approach, as opposed to this singular, siloed approach towards specialized care. I think patient reported outcome measures and that longitudinal measurement is incredibly important in this. So to be able to have individuals talk about their symptoms, and that's why I'm so excited by some of the companies that are here, that really does allow for that tracking of symptoms and patients to be able to actually have data to bring to their doctors to show this is what I'm feeling, and it allows them to actually articulate clearly what that is. All that leads to, an increase in awareness and education. That all in turn leads towards increased research and funding, which helps to contribute to a more nuanced understanding of treating the individual, and then also to consider other risk factors to ensure that that person's health, is thought of in a more holistic approach.
Yeah, and I really appreciate you calling out the implications for disease states or conditions that sit beyond what we traditionally kind of think about in women's health, which is the fertility side of things or menopause. The impacts on cardiovascular health, the impacts on, mental health, the impacts on so many other aspects that we just kind of get lumped in together, as with men and women and all of that. And really these differences do have a significant impact. The hormones changing and things like that have a significant impact on women's health, and it's just not very well understood. But hopefully, this heavy focus that we're seeing in fertility and perimenopause and menopause, like what we're seeing today and some of the work that you're doing, that insight can support understanding into some of these other areas of need as well. Can you talk a little bit about, your thoughts on how we can learn from this particular space into other areas like cardiovascular disease or mental health for women?
Yeah, one thing that we're especially, working on right now, grain fertility, and I think is pertinent to this conversation and to women's health in general, is the need for care coordination and improved access to information across different care settings. For, a long time, as I mentioned kind of earlier, health is often thought of as by per specialty, where a specialist will only manage and treat the specific symptoms and disease that is in their in their training. While that's not the way that women's health or individuals' health works at all. There are multiple tie-ins to different diseases, to different systems in the human body, and these impacts are more complex than I think we realized for a long time. As we start to understand, the increases in risk factors that can contribute, in fertility, one of the things that we're starting to examine is what are the other risk factors that fertility treatment can have that can lead to preeclampsia, that can lead to high-risk pregnancies, that can lead to, other things that then contribute to other risk factors later in a woman's life. And how do we try to reduce those downstream impacts and provide more personalized care. So I think the same thing applies here. So if we can increase the interoperability of the information that's available, have standard longitudinal data sets that are available to be able to be tested, to be able to be examined and learn from, I think we really start to see how can we treat a woman's health through the entire reproductive health cycle, which includes menopause, to ensure that that is going through and that care coordination takes place. And, I'm hoping that we're starting to see this groundswell and shift in the ownership of this from just being at the care settings to including the patient as equal partner in that care. And I think the ownership of this data and the accessibility of information, which has never been greater, can help contribute to that and equalize. And I think a lot of the innovations we've seen today really do show that companies and people are working to develop these tools to help empower that, to be able to develop a better understanding that can lead towards improved diagnostics, therapeutics. How can we develop personalized medicine that really does treat that individual, and we're not just managing the symptoms, but we're actually trying to mitigate disease, decrease risk, and really improve holistic health for the individual.
Holistic health. I love it. I mean, it's so important. One little shameless plug, Joe, for both of us. I know you're going to be speaking at the summit coming up in a couple of weeks. Do you just want to give a little preview of what you're going to be sharing and talking about?
Yeah, one of the things that's, my background is in policy. So I've lived outside DC for a really long time. And, one thing that I think is incredibly important is that empowerment and the advocacy perspective on this. So as we look towards the innovation lab, and then the ability for us to be able to have a conversation is, how is the fertility space starting to evolve in this? How are we working to empower individual patients? But at large, what are some of these macro changes that are taking place in women's health, and how can we all kind of contribute to that? We've talked about some of the improvements that have come about data, investments, awareness, education, but really trying to continue to promote that. And, I think organizations like HITLAB and meetings like these are incredibly important to have stakeholders together and to have these conversations about how, this all impacts other diseases, this impacts other areas, and how do we have that more holistic approach to everything. So, I'm kind of looking forward to that conversation, but more importantly, having conversations with so many other people that are working to innovate, in the area of women's health, so that we can have these type of relationships that does promote that care coordination. And, I think the emphasis on partnerships that I've heard from the companies is a great thing to hear. I think we're starting to realize that we can all get further together, and by, having information that's only available in one place, it actually impedes good care for patients. And all this in turn leads towards better outcomes, which is really better business for everyone.
Yeah, and you know what, you brought it all full circle to the beginning when Ben was talking about partnerships, in the keynote. Like, it really is about that, and clearly you're very dedicated to that. The Hit Lab is, and all the folks at Versalie and the finalists here today are really all about how do we work better together to bring these solutions so that people can live better, healthier lives, and it just fuels more innovation in other areas. But thank you so much, Joe. Great conversation. I'm excited to meet with you in person in a couple of weeks at our Innovator Summit. And again, don't forget to go to register if you haven't already and get a 30% discount with the Versalie code word. But anyway, Joe, thank you so much. Great to talk with you.